Men over 60, I want to start today by saying something that may surprise you, and I want you to hear it without judgment or embarrassment. Many of the changes you notice in your body as you age are not signs of failure. They are signs of shifts in how your nervous system, circulation, and stress response work together. And when it comes to firmness, responsiveness, and confidence in intimacy, the biggest issue I see in my work is not hormones alone, and it is not age itself. It is nervous system disconnection. Most men are trying to fix a neurological problem with mechanical thinking, and that is why so many solutions fail. I'm Dr. Michelle Zion. I've spent years studying how the brain, nerves, and blood vessels communicate, especially in men over 50. And today I want to explain something that almost no one talks about in a calm, respectful, science-based way. There is a specific nerve network in the male body that plays a major role in firmness and arousal, and learning how to gently reawaken that network can make a meaningful difference for many men. This is not a miracle cure. It is not instant magic, but it is real physiology, and when you understand it, everything else you've been told starts to make more sense. Before we go any further, I want to be clear about what this conversation is and is not. This is educational information. It is not explicit. It is not instructional in a graphic way, and it is not a replacement for medical care. What it is an explanation of how your nervous system influences blood flow, responsiveness, and readiness, especially as you age. When men understand this, they stop blaming themselves and start working with their bodies instead of against them. Let's talk about the real reason firmness becomes less predictable after 60. Most men assume it is purely a blood flow issue. They think, if I could just push more blood into the area, everything would work like it used to. But that's only part of the picture. Blood does not move on command. It moves in response to signals, and those signals come from nerves. Specifically, they come from a network of nerves in the pelvis that communicate directly with the brain and the cardiovascular system. One of the most important of these nerves is a nerve that runs through the pelvic region and plays a role in sensation, muscle tone, and vascular signaling. This nerve helps coordinate the relaxation of blood vessels and the engagement of pelvic floor muscles. When it is functioning well, blood flow responds naturally. When it is understimulated, overstimulated, or suppressed by stress, blood flow becomes inconsistent. This is why stress, anxiety, rushing, and pressure have such a strong impact on male responsiveness, especially later in life. Here is something most men are never told. As you age, your nervous system becomes more sensitive to context. It responds less to force and more to signals of safety and readiness. In younger men, arousal can be fast and reflexive. In older men, arousal is more dependent on nervous system balance. This is not weakness. It is simply biology adapting over time. One of the biggest mistakes men make is trying to overpower their bodies. They tense, they rush, they focus on outcomes, and they unknowingly activate their stress response. When your stress response is active, blood flow is redirected away from non-essential systems. Your body is prioritizing survival, not intimacy. No supplement, pill, or trick can override that completely. This is where nervous system awareness becomes important. There is a region of the body in the pelvic area that is closely connected to this nerve network. Gentle awareness of this region, combined with relaxation and breath control, can help send a very different signal to the brain. Instead of urgency or performance pressure, the signal becomes one of safety and readiness. And when that signal is received, blood flow responds more naturally. I want to emphasize the word gentle. We are not talking about aggressive stimulation. We are not talking about force. In fact, force often does the opposite of what men want. The nervous system responds best to subtle, rhythmic input paired with calm breathing. This is something we see not just in sexual health research, but in pain management, physical therapy, and trauma recovery as well. The nervous system is highly intelligent, but it does not respond well to being pushed. There have been studies over the years examining how pelvic nerve engagement and relaxation techniques influence male responsiveness. These studies consistently show that when men reduce sympathetic nervous system activity, the fight or flight response, and increase parasympathetic activity, the rest and restore response, vascular function improves. In simpler terms, when the body feels calm and supported, blood flows where it needs to go more easily. Breathing plays a critical role here. Slow, controlled breathing has been shown to influence heart rate variability, vagal tone, and pelvic muscle relaxation. When men breathe shallowly or hold their breath, they unknowingly increase tension in the pelvic floor. That tension can restrict blood flow and dampen sensation. When breathing slows and deepens, the pelvic floor softens, nerve signaling improves, and responsiveness increases. This is why I often tell men that firmness is not something you force. It is something you allow, and allowing requires creating the right internal conditions. This includes mental state, breathing, and bodily awareness. It also includes letting go of unrealistic expectations about speed and consistency. The male body after 60 works differently, and that difference does not mean dysfunction. Another important factor is timing. Many men try to address arousal issues after they are already frustrated or anxious. At that point, the nervous system is already in a defensive state. It is far more effective to focus on regulation and awareness before pressure builds. This is not about performing a technique at a specific moment. It is about training your nervous system over time to respond more smoothly. I also want to address the idea of instant results, because this concept causes a great deal of harm. While some men may notice changes quickly when they learn to relax and regulate their breathing, lasting improvement comes from consistency, not urgency. When men chase instant fixes, they often increase anxiety and disappointment. When they focus on understanding their bodies, improvement tends to be more stable. Let's talk about pelvic awareness in a respectful, non-graphic way. The pelvic region contains muscles that support posture, bladder control, and sexual function. These muscles are deeply connected to the nervous system. When they are chronically tense or ignored, communication breaks down. When men learn to notice tension and release it, nerve signaling improves. This is why pelvic floor physical therapy has become an important part of men's health in recent years. Many men are surprised to learn that too much tension in the pelvic floor can be just as problematic as weakness. Chronic tension can compress nerves and restrict blood flow. Gentle relaxation, paired with slow breathing, can help restore balance. This is not something you do aggressively. It is something you practice patiently. I want to say something very important here. None of this means that medical treatments are unnecessary or ineffective. For many men, medication, hormone evaluation, or cardiovascular care is appropriate and helpful. What I am saying is that these approaches work best when the nervous system is not working against them. Regulation is not a replacement for medicine, it is a foundation. One of the reasons so many online claims fail men is that they ignore this foundation. They promise results without addressing stress, anxiety, breathing, or nervous system health. That is why men feel discouraged when something works once and then stops working. The underlying system was never addressed. As men age, confidence becomes increasingly tied to understanding. When you know why your body responds the way it does, fear loses its grip. When fear decreases, responsiveness improves. This is a cycle, and it can work in either direction. Education turns it into a positive cycle. I also want to address the emotional side of this conversation. Many men carry silent shame about changes in their sexual function. They don't talk about it with friends. They often don't talk about it with their doctors. And they certainly don't hear calm, respectful explanations in public spaces. That silence makes the problem feel bigger than it is. You are not broken. You are not alone. And you are not failing. You are navigating a body that has changed, and change requires new strategies. The nervous system is adaptable at any age. That is one of the most hopeful truths in neuroscience. If there is one thing I want you to take away from this conversation, it is this. Firmness and responsiveness are not just about blood. They are about communication. Communication between your brain, your nerves, your muscles, and your breath. When that communication improves, everything else becomes easier. So instead of chasing extreme techniques, shocking claims, or instant promises, I encourage you to focus on calm awareness, slow breathing, and understanding how your body actually works. These are not dramatic changes, but they are powerful ones, and they respect your body instead of fighting it. In future conversations, I'll talk more about how sleep, movement, cardiovascular health, and emotional safety all feed into this system. Because nothing in the body works in isolation, especially not intimacy. Thank you for taking the time to listen, to learn, and to approach this topic with maturity and self-respect. If this perspective helped you understand your body better, I encourage you to stay curious and keep learning. That curiosity is one of the most powerful tools you have at any age. I'm Dr. Michelle Zion, and I'll see you in the next conversation.